Hello, welcome to today's presentation, Radiation Treatments and Technology, presented by Dr. Victor Chen, radiation oncologist with UCSF Washington Cancer Center. Dr. Victor Chen is a radiation oncologist who cares for patients with a range of conditions. He treats cancers anywhere in the body, but has particular interests in those of the breast, prostate, lung, and central nervous system. He is passionate about educating and empowering his patients so they can make decisions that support their own health and life goals. Chen earned his medical degree at the University of California, San Diego. At Thomas Jefferson University, he completed a residency in radiation oncology while also earning a master's degree in public health. Born and raised in the Bay Area, Chen was admitted to medical school directly out of a high school program as part of a medical scholars joint program of the California Institute of Technology and UC San Diego. He received a Regents Scholarship while a medical student at UC San Diego. After moving around the country to complete his training and begin his career, he is excited to return home to care for patients in his first community. Please welcome Dr. Chen.
Hello, everyone. My name is Dr. Victor Chen, and I'm a radiation oncologist at the UCSF Washington Cancer Center in Fremont, California. It is my pleasure today to be invited to speak with you as a part of Washington Hospital's Health and Wellness series on the topic of radiation treatments and technology. The Washington Radiation Oncology Center, or ROC for short, is part of the UCSF Washington Cancer Center, which is a collaborative affiliation between Washington Health and UCSF Health, which began back in 2017. Our goal is to deliver academic-level care to enhance the health and well-being of our diverse community locally, so that the residents in the area are able to receive exceptional, accessible, and personalized cancer care without having to travel across the Bay. The Washington Radiation Oncology Center is located immediately adjacent to the main Washington Hospital campus in Washington West, right next door to the Medical Oncology and Infusion Center building, ensuring that patients are able to receive coordinated cancer care as centrally and conveniently as possible. As a radiation oncology center is a freestanding, separate building, it offers a comfortable, private, and peaceful environment for patients receiving radiation treatment. In general, the full radiation oncology team is available on-site to take care of patients, including the physician, the radiation oncologist, oncology-trained registered nurses, including nurse navigator support, medical physicists, and dosimetrists, as well as radiation therapists. All radiation oncology appointments, including the consultation, treatments, and follow-ups, are all performed in the Radiation Oncology Center building, and radiation treatment is typically given on an outpatient basis, meaning that patients don't have to stay in the hospital for their treatments. Now I'll move on to talk about the process of receiving radiation treatment. Generally, patients who are determined to be possible candidates for radiation treatment are referred to us directly by another physician, such as a breast surgeon, a medical oncologist, a neurosurgeon, or a urologist, to obtain care at the Washington Radiation Oncology Center. Our nursing team and nurse navigator reviews all the referrals that are submitted to us and triage each patient in collaboration with our front desk staff to schedule patients as appropriate based on their diagnosis. Then, patients are scheduled for an hour-long consultation appointment where they'll meet both the nursing team as well as a radiation oncologist. During this consultation appointment, a radiation oncologist, such as myself, will sit down with the patient to review their history, work up to date, including all lab work and imaging, symptoms, and discuss individualized, personalized radiation treatment options. I would encourage all patients to bring family or friends to the consultation appointment, as a lot of information is shared during this visit, and it's often helpful to have an additional set of eyes and ears present. Here on the slide, you'll see a picture of our typical clinic room. We have a comfortable exam table, which we may or may not need depending on the exam sites that are needed to do a physical exam. We have a computer as well that will be helpful if any imaging needs to be shared with the patient, and multiple chairs available for both yourself, the patient, as well as your family, which you may wish to bring with you. We also have a lot of natural light coming in through this window over here. Once a patient decides to proceed with radiation, if recommended by the physician, the next step is for the patient to undergo what we call simulation. The simulation appointment, which is also sometimes called the mapping appointment, is essentially a practice run for the patient. And just like the consultation visit, it takes place in the ROC building as well. For the physician, the medical physicist, and the dosimetrist, the simulation gives the team the information needed to precisely plan out the radiation treatment that has been recommended and prescribed to the patient, such as calculating how best to angle the radiation beams for the patient's individual anatomy and cancer location. For the patient, it allows them to experience what radiation treatment will actually be like without receiving any radiation treatment on the simulation day. This includes meeting our radiation therapist team, who will be the primary team responsible for interacting with the patient during both the simulation appointment as well as all the subsequent radiation treatments that are given to the patient. During the simulation appointment, the patient is instructed to lie down on a CT scanner table pictured on the slide with the assistance of our radiation therapists. A custom immobilization device may be created during the simulation appointment depending on the radiation treatment body site, as well as the patient's anatomy. And this is needed in order to create a reproducible position that the patient will be comfortable in during each subsequent radiation treatment. The patient then undergoes a CT scan in the treatment position, and permanent tattoo marks about the size of a small freckle may be placed on the patient's body. And again, this does depend on the planned treatment site. This is needed to help with the precision alignment that is needed during radiation treatment down to the millimeter. Finally, verification pictures are taken in order to document completion of the simulation process. The patient then goes home while the radiation oncologist works with both the medical physicist and dosimetrist to create a safe and effective radiation treatment plan that is customized and designed from scratch for each individual patient. This treatment planning process can take about 1 to 2 weeks, depending on the complexity of the case. During this time, the nursing team will also reach out to the patient, typically on the phone, to educate them further about what to expect during treatment and help them navigate their upcoming treatment schedule. This is very helpful for helping to set the stage for patient expectations and knowing what is coming down the road. Once a radiation treatment plan is complete, the patient will be contacted and scheduled for a start date to begin their cancer treatment. Depending on the type of cancer, stage of disease, and other clinical factors, patients may be recommended a wide variety of radiation treatment courses that can come from as short as just a few treatments in duration, all the way to treatments lasting up to 8 or 9 weeks. Radiation treatment is typically given on an everyday schedule, and radiation is usually given Monday through Friday with weekends and holidays off. However, it's important to remember that this schedule can vary depending on your specific situation. The Radiation Oncology Center at Washington Health is open for treatment appointments typically from about 9 a.m. to 4:30 p.m., and patients are typically able to keep the same treatment appointment time slot throughout their treatment course. It's important to remember that every single patient is monitored closely by both the nursing team and the treating physician during their radiation treatment course. In fact, all patients are scheduled to meet with the doctor once a week during radiation treatment. And if issues arise in between these scheduled appointments, patients are encouraged to speak to an available nurse who will then triage their concerns appropriately and contact the physician if needed. Each patient will have a different expected side effect profile, including both short-term and long-term side effects during the radiation treatment. And this depends on both the body location being treated as well as the dose of radiation that has been prescribed. For example, breast cancer patients may experience skin-related side effects corresponding to the treated area on the chest, whereas prostate cancer patients may experience urinary and bowel movement-related side effects since they receive radiation treatment to the pelvic area. I encourage all patients to speak directly to their radiation care team to ask about the side effects that are expected with their specific treatment regimen. We also frequently collaborate with other members of the patient's medical team, which includes medical oncology, palliative care, or primary care as indicated, to manage the side effects that patients may experience during radiation treatment, as well as work with ancillary services such as nutrition or rehabilitation services, depending on the patient's medical needs. I want to close by emphasizing how much excellent radiation technology is available at the Washington Radiation Oncology Center. At the Washington Radiation Oncology Center, we are able to deliver the most advanced radiation oncology therapies close to home for members of our local community. In the picture, you'll see the Varian TrueBeam linear accelerator which we use. This is an advanced system that delivers a broad array of powerful radiation oncology therapies with high accuracy and precision. For example, the machine treats tumors with pinpoint precision as it checks accuracy every 10 milliseconds. The machine is also capable of providing extremely fast treatment times, with most patients being able to complete their daily radiation treatment in as little as 5 or 10 minutes. Furthermore, the machine is able to perform respiratory gating, making it possible to monitor and compensate for the slightest movements that can be caused by a patient's regular breathing cycle. Finally, we always have the patient experience in mind. The Varian TrueBeam Linear Accelerator treatment room is designed for patient comfort as well as stress reduction, with quiet operation, music, and two-way audio-video communication all available for patients as well. We realize that the cancer journey is difficult, but we hope that our patients will take comfort in knowing that there's a skilled team in the Radiation Oncology Center who is here to walk alongside you during your cancer journey. Thank you for watching. To learn more, please go to our website at www.washingtonhealth.com and search Radiation Oncology for more information about the services that we provide.
Thank you so much, Dr. Chen. We do have a few questions for you. Are there any common side effects from radiation therapies?
That's a great question. As I mentioned during the presentation, each patient's expected side effect profile may vary depending on the expected dose that is to be delivered, as well as the location/body site that we are planning to irradiate. However, there are some common side effects that most, if not all, patients generally receive. One common side effect is fatigue. Patients will generally feel a little bit tired after radiation treatment, and this is not to say that they won't be able to take themselves to and from the radiation oncology appointment if they would otherwise be able to drive, for example, but it does mean that they might feel a little bit more tired out at the end of the day and maybe need an afternoon nap or just go to bed about half an hour or an hour earlier every night. It's also important to note that the short-term side effects are cumulative, meaning that during the first or second week of radiation treatment, patients generally don't experience too many side effects, but towards the end of treatment, particularly during the last week of treatment or the week following the completion of radiation treatment, these side effects can become more noticeable. One important misconception that I would like to bring up is that patients often ask if they'll be radioactive after radiation treatment, and patients are not at all radioactive after radiation treatment, and there's no contact precaution, so they can be close to other members of their family, including babies and pregnant women, without any worries from that regard.
Thank you. Our second question is radiation targeted to a particular area of the body, or does it affect the whole body at once?
That's also a great question. So it does. Radiation treatment is targeted specifically to just one area of the body. However, the extent to which radiation may be targeted does depend, once again, depending on the stage of the disease as well as the location from which the disease originated. For example, oftentimes radiation oncologists, including myself, may deem it necessary to cover what we call elective lymph nodes, which means lymph node areas which drain the primary site of disease or primary site of cancer, which we consider to be at high risk of disease involvement, even if there isn't clear involvement on imaging or on surgery results that that area is involved. So generally, I would say that a specific area of the body is covered, although the area may be larger than you would expect based on where the tumor is involved. But each patient's radiation treatment field is individualized based off their anatomy as well as their stage and extent of disease involvement. And that does go back to your first question where we ask about the expected side effects, which also ultimately does depend on the treatment field.
Thank you. This concludes our program. Thank you, Dr. Chen, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.